Hormonal imbalance. It happens to both men and women when we get older, but there are treatments to help ease those transitions for optimal health. Joining us with more on hormone replacement therapy is Dr. Brannon, Medical Director at Optimal Bio. And one thing I will just have to say is you corrected me before we got started here, and that is it's not necessarily an age-related thing. So thank you for being here. And why don't we just talk about what hormone replacement actually is?
Our hormones are, the Greek word means messenger. It communicates cells to do certain functions, and it starts in the womb. But it's very important to understand that there's multiple functions for that, and what are the optimal numbers are. So when I look back at what were the numbers 50, 30, 60 years ago, and I look back at those numbers.
Yeah, and what is causing people to require hormone replacement?
Well, let's look at a couple hormones that we know more about. We'll talk thyroid. Thyroid is a hormone. When we lose that for hypothyroid, Hashimoto's disease, we don't argue if you have to replace it. We not say it's part of aging, we replace it to optimal levels, not age-related levels. Same thing with insulin. If we don't use insulin, we will have major problems with that. So the same thing, we have a optimal dose for insulin. But your ovaries or testicles, when they start off lower or lose over time, we say that's part of aging. We're just aging at a much faster rate, and they have 300-400 functions each. So for me, it's very important to understand the science. In our bodies, both men and women have estrogen and testosterone. And the way the body works is your body makes testosterone first, converts to estrogen, but then estrogen turns it off. In the last 50 years, we've been having these fake estrogens in our body, in our diet. Plastics, Roundup, pesticides that are tricking our body that we're making more than when we are. They're called neuroendocrine disruptors. So our bodies are making less. And we're calling these less numbers normal. It's like checking what's a good blood sugar. And we have 10,000 patients studied, but they're all diabetic. Yeah. It's irrelevant what the number is.
Sure. Sure. So you say that this type of issue starts in the womb, that this is not necessarily an age-related issue. So you say that it's exposure to all these things, the plastics and the Roundup and all of that. Now, what are the complaints of your patients, no matter what their age is, that is a direct result of that exposure and their need for hormone replacement?
It's very interesting. I don't care if you're an 18-year-old boy, an 80-year-old woman, tired of being tired, brain fog. Those are the two issues, number 1 and 2. Hormones
we really associate with kind of our mental well-being and our emotional well-being. Are there any other physical manifestations?
Burn fat, build muscle, make bone. Testosterone actually makes a cell called osteoclast to make bone, the proper bone. When something has over 400 functions, you ask me what it does. It helps insulin sensitivity, so less diabetes, visceral fat. But the big thing is the cognitive and the cardiovascular protection.
Okay, who's affected more, men or women?
In our practice, we have about 50-50.
Is that right? And how soon after you start the hormone replacement therapy do you actually start to see an improvement?
It depends on the symptoms. We'll talk about hot flashes in a menopausal woman. That's probably a few days. Overall energy, about 3 to 4 weeks. We check labs at a month to see where you're at, because that's when the level peaks. And our route of administration is important. We're using these small pellets that have been used for over 80 years that actually are the best way to mimic your body's own production.
And you say that these are pellets, and they're pellets that are inserted under the skin.
Under the skin.
Are they synthetic, or are they holistic?
They're actually atom for atom, molecule for molecule, the same exact structure a body makes.
Is it expensive?
A woman is about $4 a day. A man's about $5, $6 a day.
Right. All right. And you have a new office opening?
Yes.
This is in September. And where is it located?
Mount Pleasant.
Mount Pleasant. All right. So how do people find you?
OptimalBio.com. We're on every social media website. We have a podcast. We have Instagram. You name it. Our goal at Optimal Bio is to educate. That's what we want to educate.
We've just scratched the surface here. Would love to have you back.
Well, my honor.
Thank you so
Thank
much,
you so
Doctor.
much.
We're back after this.